So this is a what we call a skill station for the emergency physician. So basically, this is a full day of training for the local emergency doctors in Chatham-Kent. So about 20 physicians have signed up throughout the day and go through a number of different clinical skills over the course of about 3 hours or so. Some of the skills would include something like Blakemore set, which is a tube that we use to stop big upper gastrointestinal bleeds. There's also a lumbar puncture station or like a spinal tap puncture station. There's also a station for central line insertion, which is an ultrasound guided IV. If you think of it that way, it's a large IV that we use to resuscitate patients. So those are some examples of some skills that we're doing today. And so the point of it is to try to allow emergency physicians a chance to practice on mannequins and other training devices, so that when the time comes when we need to do this in the emergency department, we're fully trained and well aware of some of the steps and have had some practice. So yeah. So the other thing I'll also mention is that the training today is sponsored through Scotiabank and MD Financial, which is through a donation to the Chatham-Kent Health Alliance Foundation. So that's actually allowed us to facilitate this session. So in terms of traveling, so yes, this program, Dynamic Simulation, is a travel simulation and education program. So we go to multiple different hospitals throughout Ontario. Basically, anybody who's interested in bringing this type of training will go there. So for example, we went to Leamington about a week ago, as well as Kitchener a couple of weeks ago, and then have multiple other places in the future that can all be found on the website, which is www.dynamicsimulation.ca. I think the thing I'll say is that we have a great group of emergency doctors here in Chatham-Kent, and they're all wanting to learn more and to be better, and that I think speaks volume to the group that we work with, and that we all just want to serve the patients of the Chatham-Kent community to the best of our ability. So kudos to the group here for making this happen. So.